Hello and welcome to today's Health Professions Education Programme information session. Thank you very much for joining us. My name is Rihanna Patel. I'm a current medicine student here at UCL and your chair this afternoon. We hope this session will address those course-specific questions you may have and will help you gain an insight into what it is really like to study on one of our master's programmes. I'm delighted to welcome today's speakers, Dr. Miranda Cronfley, who will provide you with a summary of our health professions education programme, and there will be a Q&A session for the second part of the event. This session is being recorded and will be made available on our website following today's event. We're here to respond to your questions, so please share those throughout using the Q&A function on Zoom. So now to introduce our speaker, we have Dr. Miranda. Miranda is the co-director of the Masters in Health Professions Education and Divisional Graduate Tutor for Postgraduate Taught Programs at UCL Medical School. She is also one of the postgraduate personal tutors. Her teaching and research focuses on postgraduate teaching and learning to improve the quality of healthcare through facilitating students to become effective leaders of learning in the clinical workplace. She also has an interest in educational injustice and fairness in assessment and leads quality assurance and evaluation for the PGME team.
Fantastic. Thank you so much, Rihanna. It's an absolute pleasure to be here today to give you all some information about the MSc Health Professions Education. And I very much hope that you will feel free to post any questions that you have, which I will be delighted to answer. So as Rihanna introduced, this is the Graduate Open event for the MSc Health Professions Education. Looking forward to the 2024/25 entry, so that's autumn 2024. So as Rihanna said, my name is Miranda Cronfley. I'm a clinical associate professor here at UCL Medical School, and I'm the co-lead for the master's programme in health professions education. So this is the programme that we're going to be talking about today. It's the MSc in Health Professions Education. So first of all, a little bit about why you might want to study at UCL Medical School. So as the UCL website tells us, there is a little section there that says why study at UCL. It reminds us that UCL is renowned for world-class research, for its global influence and for its impact across a range of subjects. Personally, as a former master's student at UCL myself and a staff member and now as a doctoral student, the thing that attracted me to UCL was this last one in terms of the broad range of subjects. So of course we know that UCL has a world-leading STEM research and teaching record, especially here in the Faculty of Medical Sciences. But importantly, for those health professionals considering pushing the boundaries a little bit in terms of their kind of exposure to academic topics beyond science, beyond healthcare, beyond medicine, into education, UCL has a very diverse range of subject areas, in particular a strong social science, psychology and education focus in dedicated faculties. And for me, that was a really important component as I kind of moved from kind of biomedical science, academia, a background into thinking about education and those sorts of different ways of seeing the world. You know, studying people's learning, which is often described as meaning making, is much more of a kind of social science endeavour and a different way of looking at the world. And UCL is a very strong university in terms of that kind of subject area. In terms of why you might want to study at UCL Medical School, the MSc in Health Professions Education programme is hosted from one of the particular units within the medical school, which is the postgraduate unit. And the postgraduate unit sits alongside the MBBS unit, which is the medical undergraduate unit, the SciMet consultancy unit, and the research department of medical education, all of which are housed in the department of the medical school. And this means that if you study on the MSc Health Professions Education programme, as well as experienced teaching academics like myself and the programme co-lead Kerry Calvo and our tutors and researchers on the programmes, students actually have access to a broad range of expertise from the wider medical school team and the research team, both as tutors on their modules and potentially as MSc supervisors. So that's a little bit about where the course is located and why you might want to study with us in that sense. The other reason why people very often are keen to study at UCL is that it brings together the highest kind of in quality offering in terms of study and in terms of research and in terms of medicine, but also is a world leader and a UK leader in its diversity and inclusion, both in terms of its policy and in terms of its history. So you can see from this slide that it was the first university in this country to welcome students of any or no religion, and the first university in this country to welcome women to a university education. And those traditions are continued in the day-to-day work that we do, for example, in projects that I lead, looking at equity and injustice in education. So why might you want to choose this particular master's programme in health professions education? Well, the main thing that differentiates us really from our colleagues in other master's programmes is the flexibility. So students undertake our programme on a module by module basis, choosing as they go which modules they'd like to do. Every year, students are asked by the administration team what their intention is in terms of continuing, and students have the option of then totting up their credits and saying, actually, I've got 15 credits, I've done a CPD module, that's enough for me, or I've got enough credits now to exit with a certificate, or perhaps I'd like to carry on and do a diploma or do a full master's. But you don't need to have decided this in advance and then commit to it. So you can literally dip your toe in, try one module, try a certificate, and then progress and carry on if that suits you. And this is also reflected in the convenience. So it's a completely online program. Learning activities are undertaken in discussion forums on Moodle, but also with live sessions on Zoom. And many students find this quite convenient to fit into alongside their full-time or even sometimes part-time work as a healthcare professional. And I think it's not just about the convenience and the structure of the programmes. The tutor team is made up of a large number of health professionals by background ourselves. So we understand, many of us studying to do a doctorate or other studies. So we all understand what it's like to be working full-time, to be clinical, to be trying to fit studies in, to balance that with constraints of family life, changing rotas, all those sorts of things. So it's a very understanding faculty in that regard, and we really, really will support you in order to get the best out of your studies. And the last thing is choice. Amidst all of that, there's a broad range of modules, and you can choose as you go through the program, you can choose which modules you want to pull together to create the building blocks for your own program of study. So in terms of what your journey might look like, as I said, it's a flexible modular program. You can study this part-time and you have 5 years to complete a master's, or you might want to take a year out of your work and study full-time over 1 year. And as I said before, the delivery is online, and although it's online, we have an emphasis on collaborative learning with a lot of expertise and experience in the team on how to make learning feel collaborative and social, even though you're accessing it usually on your own from home or from your workplace via a computer. So we very much hope that it's a collaborative approach that we offer. In terms of the qualification options, I've touched on this already, but to get the full master's, you'll need to get 180 credits made up of 15 or 30 in some cases, 15 or 30 credit modules, and then a 60 credit dissertational report at the end. For a certificate, you'll need 60 credits from modules, and for a diploma, you'll need 120 credits from modules. And as I said, you can kind of put that together as you go along. Now, we also have some special interest pathways. You can exit with this top spring green one at the top here, the general one, so you can exit with an MSc Health Professions Education with no specific special interest accreditation, or you can choose a leadership one, a primary care one, or a research one. Just gives you a specialist area for your qualification. We also have an assessment pathway. It's not open this year, but we hope that it will be open next academic year. So to undertake a special interest module pathway and get that qualification, you'd have to take at least 50% of your modules. From that, the specific prescribed menu of modules for that pathway, and also the dissertation or your report, which is a depth-based piece of research, would have to be in your special interest area. So this is an example of the modules you'd need to take to complete the leadership special interest pathway. So we've got 4 leadership modules there. This is for the research pathway. So as you can see, we've got 4 research modules there. This one is for the primary care pathway. And then this is the new assessment pathway, which we hope will be open in the 24-25 academic year. Okay, so what does day-to-day learning look like if you're studying on the Masters in Health Professions Education? So there's a variety of ways that the modules facilitate learning for students. First and foremost, and really important to say, is reading. So we have a reading list for each module. The activities on the module will be linked to texts on that reading list, usually book chapters or journal articles available included with your student membership via the UCL online library. So all those readings are accessible to you, and reading really does form the mainstay of your studies on the programme. Yes, there are live teaching sessions. Yes, there is some kind of content posted on Moodle to introduce you to topics, but immersing yourself in the academic literature and taking time to read and explore all those topics of interest is the most important part of your studies, and you're very much supported to do so by your tutors. There are different sorts of resources on Moodle, which is our virtual learning environment that we use, the software platform. Often that's in the form of videos, often that can be in the form of text as well. In terms of exercises and learning activities, you take part in a lot of your learning using discussion forums. Some of that will involve feedback from tutors, and some will involve feedback from peers. And you also have pair work or group work, or either kind of in live groups during teaching days or using collaborative documents. So there's sort of solo learning activity work and pair or group collaborative learning activity work. And then finally, all the modules have a series of live online sessions where you have live support and teaching from module tutors. So that's what the learning looks like on the programme. When you're thinking of signing up for a master's, I think what I would recommend is one of the most important questions you can ask yourself is, how much time do I have to dedicate to study? Because master's study is much more time consuming than I think a lot of people realise. And really, we kind of say you need 10 hours a week for a 15 credit module. So a 15 credit module lasts 8 weeks, and then you have around another 8 weeks after the teaching has finished to complete your assignment. And in each of those weeks, you need half a day to a day. So we'd say 10 hours really to read and complete the learning activities and complete the assignment. So that's the first question you should ask yourself if you're interested in considering master's study. I think a lot of employers, colleagues, workplaces, really respect the fact that actually you would be taking on such a significant professional development ambition. A lot of the time, it's worth approaching them to understand whether they might be able to fund the masters. But as well, I think it's worth pushing a little bit for some study leave or some flexibility with your working hours, using the fact that actually you're doing a master's to try and gain support for taking time off and protecting time for your studies. Certainly, a lot of our students have actually said they didn't necessarily think they would get time off, but when they went to colleagues or supervisors or line managers and said, actually, I'm doing a master's, there was support was sort of provided in terms of protecting time. And it's really important because we do appreciate the fact that in the clinical world, things are really pressured and it can be very, very hard to make time. So I think this is something that's really, really important to think about from the get-go. So another really important thing is assessment. So how do we assess you to allow you to demonstrate the standard required to gain your credits or your certificate or your diploma or your master's? So each of our modules has a summative assignment at the end of the module. These are traditionally written assignments, so often it's a 2,000 or 3,000 word essay based in the academic literature with a brief given to you on the module. But we are now broadening our range of assessment types. So for example, this year we've introduced video presentations for one of our modules. All the modules are optional, and actually you'll be made aware of the assessment options or the assessment format for each module when you're choosing your modules. So you'd be able to sort of choose modules perhaps based on that. All the modules are optional, and you can have a look at the assessment type before choosing your modules. To support people with preparing for their assessments, we also have a lot of formative assessments, so opportunities for you to learn and get feedback to improve your performance, both on the modules, but also when you hand in a written assignment, you get extensive written feedback about how to improve for next time. So that's the assessment side of things. Amongst all of this, one of the most important things that is really, really key for us as staff is to consider carefully how we support you as students, especially given what I mentioned just now about challenges in the NHS workplace, often meaning that unexpected circumstances arise and you might not necessarily anticipate needing support when you start your studies, but it can happen. So what do we do to support our students on the MSc Health Professions Education? Well, the personal tutors are the first port of call. We have 3 personal tutors on the programme, all with experienced academic and pastoral and clinical backgrounds. And they are available very easily. Their contact details are made publicly available to students as soon as they start on the programme. And there's no kind of hoops to jump through to make a personal tutor appointment. You don't even need to give a reason. So we have very accessible personal tutor support. And there's also support from our administrators as well. In terms of what UCL provides students, what you kind of have access to and you're entitled to as students, the Academic Communication Centre provides a range of support, from resources to one-to-one tutorials with academic writing. There's also extensive support available dedicated for students for whom English is not their first language, including peer support. So there's all sorts of writing support available. And then we have an absolutely fantastic student support and wellbeing team who have a dedicated website. They give support from anything to advising you on how to use the UCL regulations to your advantage if you have a disability or a health issue, to how to gain access to resources if there's anything you particularly need support with, all the way through to counselling sessions to support your emotional well-being. So they're a fantastic team, really supportive. We work closely with them, and they are very, very good at what they do, and they provide fantastic support to our students. And then there's a nice kind of centralised UCL technical support team where you can ask about anything in relation to your studies via the online platform Ask UCL. How did we get to the point of having our programme in its current iteration with all the support that we provide to students, with the way that we teach students on the programme? It's through having students closely involved in the programme, all the students on the course having a say in the running of the programme, but in particular through having student reps who liaise with the student body to make sure that students have access to anonymized feedback channels if they want to, but also access to basically feeding back to staff a general consensus about students' experiences on the programme. I'm afraid that my PowerPoint has now crashed, so I'm unable to continue sharing the slides, but I think that brings us very close to the end. and I think that's my 20 minutes session up. So what I'll do is I'll try to restart PowerPoint, but if not, and Rhianna, I'll hand to you for closing remarks.
Yeah, no worries. Thank you so much, Miranda, for this very informative session. Are there any questions? We still have an attendee. If you wanted to ask any questions, we can answer anything that you want to ask. But otherwise, I think we can close it here if there aren't any questions. But yeah, thank you so much, Miranda.
I think Rhianna, if we've got a couple, have we got a couple more minutes left in the session?
Yeah, of course.
Because there are a few things that I think potential students might feel helpful to know that were in the last few slides. So yeah, I can just perhaps brief on those without the slides.
Yeah.
Because I think a lot of students are quite keen to sort of understand where an MSc in health professions education could lead them, for example. So to sort of think, well, hang on, if I do get this qualification, or even not, get the qualification, but sort of embark on this program of studies, what sorts of things might this add to my clinical education practice, really? So I think that's quite important to say. And we do have students who engage with studying on the programme for quite a wide range of different reasons. So a really typical thing might be that a student might be a clinician with an education practice, or actually we do get some people working in other settings, like in a corporate setting or in a higher education setting, but with a clinical education practice with healthcare professionals as their learners. And they're sort of either they're pitched into a job and they're just doing what comes naturally to them around teaching, and they think, actually, I would like to consolidate this or even credentialize this, either to help me with a bit of imposter syndrome, or to give me some extra tips and tricks around teaching, some practical support, or just to help me make sure that what I'm doing is along the right lines. So that very practical focus. Some people find teaching, its philosophy and the way they interact with others and the impact they have on people to be really intellectually stimulating, and want to kind of understand, who's gone before, what people have written, what's the academic literature saying about teaching. Some people have got questions about their practice and how things should be done to make their teaching, or make teaching in their setting as good as it can be, and wish to undertake research. So they might do it for that reason. And some people, I think this is possibly nowadays one of the most common ones, some people actually are really doing it for a very specific reason in relation to their career direction. So people might be doing it because of the role they want to apply for, and they want to be competitive, and they want to get a credential on their CV, whether it's a certificate or a master's. Some people might be doing it not for that specific reason, because they haven't seen their vision yet of what they want to do for their career, but they know that they want it to be about education. They've got that passion for teaching. They're really clear on that, and they just want to consolidate that, credentialize that, and see where that will take them. And I do actually have my slide is now working again, and I can show you a range of roles that people might typically take on as they leave and graduate from the program. So this could be something as sort of shop floor almost, as a nurse preceptor or an educational supervisor, or it might actually be something in a more formal role, like an education lead in a trust or a company, a program director for a training program, a curriculum lead. It might be that you want to do some assessment and some examining yourself, and you might even want to be involved in assessment design. So you might want to credentialize in assessment side of teaching and learning for that reason. Or you might want to go on to sort of academic roles, whether it's to be a clinical academic yourself, to work in a university environment yourself, or to go on and undertake doctoral studies to prepare you for future research. So that's a little bit of an example about why you might want to career-wise take part in studies on this programme. Finally, the last bit of information is our programme is accredited by the Faculty of Medical Education, Leadership and Management, and the Association of Medical Educators. So just a bit of extra information about that. But if you do have any more questions, or anyone viewing the recording has any questions, please do stay in touch. You can email our administration team, which is the email address there, or I'm very happy for people to email me directly. My email address is miranda.cronfley@ucl.ac.uk. So yeah, please, I mean, it may be that watching this presentation has given you more questions than answers, so I'm really happy to take any questions via email. And that brings things to an end, I think, Rihanna. Thank you very, very much for the extra time.
Yeah, no worries. Thank you so much. Maybe I'll give a few minutes for the attendees to put in any questions that they have right now, because they can be answered right now live by Miranda. So we'll stay a few minutes and then see from there.
Yeah, sure. Great.
That's all right with you. Feel free to ask anything, any queries, just put them in the chat. Yeah, so we were just saying, please do add any questions, anything you want to ask, Miranda, anything.
Yeah, I'm happy to take any questions, but also if you want to drop an email.
I think we have one question.
Oh, great.
So they're interested in doing their PGCE in medical education, but have not been able to find what the requirements are with regards to teaching hours.
That's a really good question. Nice to know that people are considering the kind of practical considerations of their program before they start. So let me take you back to our slide on the format of a certificate, because I think that's probably the most pertinent one. So a PG certificate, you would need to gain 60 credits. That would be in the form of either 15 credit or 13 credit modules. Typically, students do 15 credit module once a term, and we have our academic year divided into 4 blocks. So you might be able to do your 60 credits over 1 or 2 years. So you would do your first 15 credit module, for example, if you started in the autumn term, you'd start in the first week of October. Your teaching would last 8 weeks, and then you'd have approximately 8 weeks to go off and complete your assignment. And you would be expected to spend half a day or a day, we generally say 10 hours actually, so pretty much a whole day per week studying. Now, some of that study will be on your own, working your way through learning materials online. Some of that study would be in live tutorials. So the live tutorials, the dates are given 6 weeks or more in advance, and you put those in your diary, and they would be either 1 hour to 90-minute tutorials, or there would be occasionally a whole day that you'd have to sort of take study leave and block out. But mainly the study is what we call asynchronous, that's flexible, and you make your way through activities online in your own time. But we say it's around 10 hours a week for that.
Great, thank you. Is there anything else anyone wants to ask? Okay. I think we'll close it here then. Thank you so much, Miranda, for your time and for the informative session. You can, this recording will also be available on the UCL website if you do want to watch it again, or as Miranda said, you can feel free to email her with any questions regarding the programme. But yes, thank you so much for joining and for presenting. And I think we'll end it here. So have a lovely evening. Take care.
Thank you.